Welcome back to the Morning Blend. Most sun damage happens when we're young, but it doesn't show up until years later when we're older. As we age, that sun damage turns into dark spots, rough patches, and wrinkles. But today, a unique procedure to get rid of that discoloration, even on dark complexions.
That's right. Dr. Deborah Manjoney is here from the Wisconsin Vein Center and MediSpa to tell us all about LaseMD.
Right.
Good to see you.
Thank you.
Good morning.
Good to be back.
Those pictures, the one we showed before the break and then that right there, I think are very impressive.
They are
This is
impressive.
brand new for you guys.
This is brand new. We've got it at the end of December, and we're very excited about it. It's not a very long procedure, pretty much painless. We do use a little bit of numbing for about 20 minutes ahead of time, but most people, even my husband had it yesterday, no discomfort.
What's Scott using it for?
When being a pilot, he's out and working outside all the time. He actually is getting a lot of sun damage.
Yeah.
And I looked at him one day and said, okay, we've got to get rid of it. He's got it all along his hairline. I said, all right, we've got a new one for you.
Yeah, we got something that'll work for that.
The guys can handle it,
That's
right?
right. He can handle it, so it's okay.
So this is FDA cleared, which is
Yes.
great. People can feel assured that it's safe. And you say it works particularly well for melasma. And a lot of people are familiar with that, especially in pregnancy, because it gives you that dark masking.
It does. Frequently a mustache on the forehead or on the cheeks. Those are the most common areas to get them. And it's often hormonally related. But this works very well because it's attracted to the pigment, but it's such low energy and it's so quick in and out, little tiny flashes, that it doesn't have heat involved with it. And so you're not making it worse. And which can really happen with other kinds of treatments for melasma. Plus, with this particular company and piece of equipment, we have a drug that we can use immediately afterwards to paint on, tranexamic acid, that is commercially made by them to use only with this. So it kind of goes through a little spinning while we're doing the procedure to get it ready, and then we can paint it on the face. And this particular laser, which is non-ablative, meaning you're not going to have any injury on the surface, but it still causes these wonderful little channels, the best ever, to allow product to be penetrated.
Oh, wow.
And so we can put this tranexamic acid on afterwards. It really penetrates in beautifully, and it helps tremendously with melasma.
Wow. Another thing it's FDA cleared for is those precancerous.
Right, actinic keratosis. We're not using it for that really right now, although it's wonderful for any sun damage.
Okay.
And we can use it on the face, on the chest, on the neck, on the arms, anywhere that people have sun damage.
Wow.
What kind of downtime is involved with a procedure like this? Because people wonder, okay, if I have this, do I need to change plans, whether it's for work
There's
or going
really not.
out?
I mean, you might look a little pink for a day.
Okay.
Like Scott looked like he was sunburned yesterday till the
Can
evening.
you use makeup? Not that Scott would. Can you use makeup?
You can't use it right away. You need to wait because these channels are so pronounced and open. You don't want to use makeup or anything on your skin for several hours, at least 8 to 12 hours.
Oh, okay.
And so the next day you can use makeup,
Okay.
no problem. And you really don't look damaged the next day at all. You might. When I first had it back in November when we were trialing it, I felt a little sandy grit on my face, kind of, and it lasted for several days. We actually use a beautiful creamy mask afterwards that can soften the skin. So a lot of people have had that, say their skin feels silky by the next day.
I love how you try everything. I would too, but I love how you try everything.
I think that's important. This is one that, in particular, can be used on any skin type.
That's exactly
and skin tone.
Right. So we can use it on the Fitzpatrick scale, you know, is a very, very fair to very, very dark ebony skin, and we can use it on any skin tone at all, which is fantastic. And we can set the settings, so we can do gentle or we can do a little bit more aggressive. We can do a number of different passes, so it really is customizable to the person depending on what their needs are.
Okay.
What I love about it too, so you talked about things like melasma, age spots, the darkening, the pigmentation. But when you look at those before and the after pictures, you see sort of this glow. It the skin looks resurfaced.
It's resurfacing.
It's
that is incredible.
Yeah, that's amazing.
It
That's
really,
definitely
really is.
looks like at least 10 years.
I know. And
Literally.
that's 1 a month for 3 months.
Wow. So only
Okay.
3 treatments
Yes.
Wait, is that all you would do?
No,
or would
you
do
can
it?
you can keep it up.
Okay.
You can go on.
Go nuts.
I want to see her in another 3 months. Right? Like now what she look like. And you're going to see a change in like 2 to 5 days. Is that about right?
Yes, you will see definite improvement in your skin within 2 to 5 days. Sometimes people say that's by the next day. Certainly, if somebody has a little bit more roughness, it might take a week or so to go away. And then because it's building collagen, that takes 4 to 6 weeks to see that kind of result. So
So do you try and wait that that long between treatments?
About 4 weeks
Okay.
between treatments.
Okay.
And then you can do another one, and by the third. And collagen builds over the course of several months. So you'll still have improvement even after you stop the treatments for several months.
It's wonderful. Your March special right now is $50 off of one treatment or $200 off a package of
Right.
3.
We
So
do
if
have
you-
package pricing, which is discounted by about 10% for individual. So
Okay.
if you do a package of 3, but then we'll have an additional $200 off that, or $50 off of one if you just want to try one.
Yeah.
See what it's like.
It's a great time
Does this
to try
have the
it.
same kind of thing where you would flake afterward or no?
It doesn't really flake so much. You do have a little feeling, as I said, of that coffee ground or sandy
Like
feeling.
some of the
and so that can
damage
come off
coming
that
off,
way.
right?
Yes.
Yep.
Yep.
That is
Okay.
wonderful. All right,
That is
here's
so
that.
cool.
Yeah, here's that offer again. A wonderful thing to try, especially as we get close to spring and you want your skin to be glowing and look refreshed. This wonderful offer is $50 off of one treatment of LaseMD or $200 off if you buy the package of 3. And boy, did we see some incredible before and
Yeah.
afters with the.
I'm gonna try it.
And make your
of
husbands
treatment.
try it.
Yeah, your
This is
hubby
something
is
that
there.
won't hurt.
Call them now to schedule a consultation or an appointment. It's LaseMD is the name of the treatment, and you can call the Wisconsin Vein Center MediSpa at 262-746-9088. WIMedispa.com is the website, and they are located in Pewaukee and have a beautiful spa on Georgetown Drive. Always great
Thanks,
to see you.
Great to see you.
Have
Thank
a
you so
wonderful
much.
weekend.